Welcome to the Virtual Temporal Bone. Please put on the 3D glasses supplied and put the video to full screen. Here the Virtual Temporal Bone is drilled in a subtemporal approach. A temporal craniotomy is done. The tool rack, which is located at the bottom of the Virtual Temporal Bone, enables a wide variety of functions including magnification. The superior semicircular canal underneath the arcuate eminence and the greater superficial petrosal nerve is drilled to define them. The internal acoustic canal is located at the intersection of these two structures and is drilled to expose the facial vestibulocochlear nerves here. Kawashi's triangle, which is located more anteriorly just behind the trigeminal nerve, is now drilled extensively to show the anterior brainstem up to the level of the inferior petrosal sinus. For the pre-sigmoid approaches, the petrous temporal bone is drilled on and in front of the sigmoid sinus. This drilling is done in the cancellous bone quite rapidly, and the floor of the middle fossa is also exposed. Here the bone is magnified. The drilling is then taken more anteriorly to the root of the zygoma, and as one approaches the harder cortical bone overlying the semicircular canals, a smaller drill is used. The facial nerve is also exposed partially in its bony canal. The posterior, lateral, and superior semicircular canals are now further defined carefully with fine drilling. The canals are now removed, and the drilling is taken anteriorly in a translabyrinthine type approach. Here you can see the facial and the vestibulocochlear nerves exposed in the internal acoustic meatus. The ossicles are now defined, as is the tympanic membrane. The ossicles are now removed. The tympanic membrane removed. And the cochlea removed. The facial nerve is now completely skeletonized and exposed. In a classic transcochlear approach, the facial nerve is transposed, but we have left it intact in its original location here. The petrous bone is now drilled very anteriorly to expose the internal carotid artery in its vertical portion. For the infralabyrinthine approaches targeted around the jugular foramen, the virtual temporal bone is now drilled in front and behind the sigmoid sinus. The tool rack at the bottom is used to magnify the image again. The petrous bone is now drilled to expose the semicircular canals and the facial nerve. In this exercise, these structures are left intact, although they can be mobilized if necessary. The drilling is now taken much more extensively to show the suprasigmoid portion of the jugular foramen and to expose the junction of the sigmoid sinus and the jugular bulb. These venous structures can also be removed to provide a more complete exposure of the cranial nerves in the jugular foramen. In the transcondylar approaches used to expose the anterior cervical-medullary junction, a lower craniotomy is performed, which incorporates removal of the lip of the foramen magnum. The vertebral artery is exposed from its extracranial to its intracranial course as it winds around the occipital condyle. Here in a far lateral approach, the condyle is left intact. The jugular tubercle is drilled above the condyle. The condyle is now partially drilled in a partial transcondylar approach to expose the hypoglossal nerve rootlets in the hypoglossal canal. Drilling is now taken a bit more superiorly to expose the cranial nerves in the jugular foramen. The sigmoid sinus and jugular bulb are now exposed, and they can be ligated and sacrificed to provide a very wide and extensive exposure of the lower brainstem, as seen here.